And then with that, it is my pleasure to transition into our primary content today and introduce you all to our presenters, Paige Minking and Darrell Fox. So I'll pass this on over to the both of you to introduce yourself and start your presentation.
Thank you so much, Mung-Chi. Next slide, please. Thank you, everybody. We want to welcome everybody again. Thank you all for taking time out to join us today as we go on a journey to explore the history and work of the CHW Core Consensus, also known as C3 Project. And we're going to discuss CHW core competencies, particularly the competencies CHWs tap into daily in their roles for CCR. My name is Darrell Fox. I've served as a CHW for over 30 years. I'm a CHW consultant at JSI Research and Training Institute, and I serve as a leadership team member for the Washington State Evaluation Partnership, also known as the WASEP 2110 project team. I'm joined today by Paige Minking. She is the founder and principal of Ponderosa Public Health Consulting. She's a longtime CHW ally, and we're both part of the C3 team. And we work closely with some other folks that are joining us today who will be in breakout rooms, and that's Lee Rosendahl and Julie St. John. And we also have some other team members that are part of the core CHW team, who are Lily Lee and Flor Redondo. And there are also many additional C3 team members from over the years of the project. And we'll be sharing links today. We've already shared some information that has the full listing of all of our team members. We thank you all who've had the opportunity to do some of the pre-reading of the C3 project, the info sheet, our final report, and those who might have been able to view the video, but don't worry, those who didn't get a chance to, we'll provide some additional resources for your toolbox. And today's presentation is designed for those who may know a lot about C3 and those who may not. So I thank you. Next slide, please. So we're on this journey, and we're going to provide information and engage you all in discussion about several areas of key components of C3, including summarizing some of the history of the C3 CHW competencies. And when I refer to CHW competencies, I'm referring to CHW qualities and skills. And also we'll detail some of the development of the CHW core roles in the United States. We will be explaining the importance of field-driven consensus around the C3 CHW roles and competencies, with members of the CHW workforce playing a critical roles in leadership and in providing input. They were paramount to our work. We will also discuss some of the differences between the C3 project core roles, a nationally recognized list of core roles, and those that have been adopted by various states, as they may differ in some of the states you are working with. And finally, we'll work with each of you to connect and apply the C3 CHW project core roles and competencies to key areas of CCR in the areas of training, deployment, and engaging of CHWs, which are the primary areas of CCR. I now would like to turn the microphone over to Paige.
Hi, everybody. Welcome. Again, thanks, Darrell, for setting this up so well. So in the next slide, we will be watching the video that Darrell referenced. So this is a video that the C3 project created to talk through what it is to talk about core roles and competencies. Why is it important to think about the roles that CHWs do, the skills that they need to do their job well, and the qualities that make folks a CHW, right? So this was referenced in the pre-session reflection worksheet, but for those who didn't get a chance to watch it, we're going to watch it together here today. And you can find this video on our website as well as in Spanish. So we have it in English and Spanish on our website and on YouTube. So with that, Caitlin, go ahead and start the video.
Often people ask, what is a community health worker? Who are they? What do they do? And how do they do it? Are they outreach workers, peer educators, promotores de salud, even tribally based community health representatives? There seem to be so many diverse names. Those names reflect the diversity of the CHW field and mirror the many distinct settings and communities where CHWs serve. Are there paid CHWs and other CHWs who get stipends or even volunteer? Well, mostly CHWs are paid. Hopefully, they are paid a good living wage with benefits. Some CHWs volunteer, some because there is still limited stable funding for CHWs, and some volunteer because they want to give their time to their community. Even with all these differences among CHWs, hopefully you know a lot about what CHWs have in common. One thing you should know is that even if CHWs are not all paid or not all paid the same, CHWs are deeply committed to supporting the individuals and families where they live and work. They are part of a continuum of caring. Another important thing that CHWs share in common is their core roles and competencies, including their skills and qualities. Many people have looked to the 1998 National Community Health Advisor Study for a starting point. The study identified 7 core roles, which help define CHW's scope of practice. These roles include cultural mediation, health education, assuring access to health care and other services, informal counseling and social support, individual and community advocacy, provision of direct services, meaning health screenings and basic first aid, and individual and community capacity building to strengthen and support the skills and abilities of individuals and communities. Programs and policies to support CHW service development should ideally position community health workers to fulfill a wide range of their core roles. What happens if CHW roles are too narrowly defined? Let's take a look at what happens when a CHW works in a narrowly defined role. If a CHW teaches Diabetes 101 in a classroom but does not have the opportunity to talk with those attending the session, she cannot offer social support. Given this narrow role of health educator, the CHW might not touch the lives of those she serves, and the participants might once again be overwhelmed with the medical information about their chronic condition. They will miss the benefit of an informed ally who they can talk to about the changes they want to make and how hard it is to make them. Their condition is poorly controlled, and they may find themselves in the emergency room once again. If we want community health workers to carry out a wide variety of roles within the community, we need to make sure their training gives them the right skills. Dr. Noelle Wiggins, who led the examination of roles and competencies for the National Community Health Advisor Study, identifies 8 core skills that CHWs need, including communication skills, interpersonal skills, service coordination skills, capacity building skills, advocacy skills, teaching skills, including facilitation, organizational skills, including setting goals, planning, documenting, and research, and a general knowledge base, including knowledge about the community, specific health issues, and health and social service systems. The study also found that CHWs have many important qualities, the most unique and important of which is that CHWs are closely connected to the community they serve, sharing life experience. You may wonder whether these roles and competencies represent today's reality for CHWs as they did more than 16 years ago when the National Community Health Advisor Study was released. That is the purpose of the National Community Health Worker Common Core Project, also known as the C3 Project. Many of the same people who worked on the National Community Health Advisor Study are part of the C3 Project. The C3 Project is focused on building forward from the National Community Health Advisor Study to offer contemporary guidance on CHW roles and skills that support the work that CHWs do today. You may also wonder, what about guidance from the C3 Project on CHW qualities? The C3 Project recognizes the importance of the qualities that make CHWs effective, including their close connection to the community. The project team, like others, recognizes that those qualities are timeless and have not and will not change.
Thank you so much. Next slide, please.
Often people ask, what is a
Yes. I'm going to share a little bit more and then pass the mic back to Paige. And I really thank you all for watching that. They said so much of the basics of our project. So we're going to elaborate on some of those points. And what you're looking at now is our visual history of the C3 project, also known as our flowing river. For you, it's flowing from west to east today. And I was nominated to do this slide because I've actually been on a canoe on this winding river since the very start of this river, alongside folks like Lee Rosenthal, who's on here, Julie, and others. And so we're going to talk a little bit about the history, and just think about this movement. The CHW movement nationally and locally has really, been enhanced in leaps and bounds over the last 20 years. In the early 90s, there were conversations happening in many states about community health workers and also about how we could connect nationally. So I started in 1991 as a CHW, and being in the room and hearing those conversations, I'm seeing very similar conversations today. But there were some folks in the room that said, let's do something. And so by the mid 90s, you've already heard some of the history in the video previous to me about the National Health Advisor Study. So Lee Rosenthal, Noel Wiggins, and a whole bunch of CHWs from around the country got engaged in developing the National Health Advisor Study, which really has been highly cited to this day as one of those foundational documents that help people kind of understand who we are and what we do. Several of us were part of that experience as well. And fast forward to putting the National Health Advisor Study in action, and you look at 2000, Texas was one of the first states to actually adopt the core roles and skills. They were actually an early adopter because they were also an early adopter for CHW certification. Texas has the first statewide CHW certification in the country at around that time. Now, as you go down the river, many people involved in the National Health Advisor Study were also leadership members and involved in APHA. And in 2001, they did one of the first CHW-related policy resolutions. The CHW section created it, and it was adopted by APHA back in 2001. Since then, there's been about 3 additional policies, CHW-related, adopted by APHA. So that was 2001. And from 2000 to 2014, there were many CHW programs, including training programs, people who did on-the-job training for CHWs, who were really adopting, integrating the National Health Advisor Study roles and competencies as a guideline and framework for the curriculum. There was a lot of talk about taking a look at these core roles. Had things changed since 1998? And that kind of led to phase 1 in 2014 of the C3 project. And that's really when the project began. I'll say a little bit more about that later, but as the project went on, there was a great report and a nice policy brief. It was really needed for that moment. I think it was a 2-page policy brief, maybe 3 pages, that really talked about the list that we had developed by consensus. And so that was kind of the beginning of getting the newly recognized national list of core roles and core skills out to the world. Again, in 2017, the C3 project convened, did some work, and you'll hear about some of that later, because we decided to take a look at assessments and settings at that time. And after that, we developed a final report, which encompassed all of the work from 2014 to 2016 and the additional work between 2016 and 2018 into one package. And that package has been shared with you. Finally, one of the things we said back then was we want to revisit this, similar to what we did by revisiting the National Community Health Advisor list. We now want to revisit the C3 list. And last year, our team started to work on that, and hence why we're here with you today as we kind of revisit and start to connect with folks around taking another look at our nationally recognized list of core competencies. Next slide, please. So one might ask himself, why? Hopefully you won't now, because I think we explained it, but if one did, why did we re-explore the CHW core roles and competencies? Why develop the C3 project? I mean, really in 2014, it was a moment in the movement where there was lots of local and national advocacy and support for CHWs, but there was still limited national recognition and even limited understanding of who we are in our list of CHW core roles and competencies. The questions about who we are, what we do, were we a profession, while some of those questions still exist today, they were even more they were more prevalent back then. So C3 was kind of born to work on that. And from 2014 to 2018, we worked to build national consensus on a list of CHW core rules and competencies. And when I say competencies, I'm meaning our qualities and skills. You'll hear that word several times. So please see the pyramid to your right. Okay, thank you. You'll notice that, as always with CHWs, because the community and trust in the community is paramount to what we do and who we are. So you'll see individuals, families, and community served at the top of the pyramid. You'll see the qualities, which are foundational, supporting our roles and skills. And so this is kind of the mantra, the way we viewed and with our lens, our CHW core roles and skills and qualities package, and how we support our community. Next slide, please. Now, those of you who might have gone to one of my meetings, I don't know, 10 years ago, you might have heard me do call and response where I say, don't just talk about it. And if you know the response, put it in the chat. Don't just talk about it. Yeah, so be about it. And there were many national and many local programs that talked about CHW self-determination, that talked about CHW leadership, but when you followed the money, you followed how they operated, how decisions got made, they weren't being about it. And so I have to applaud the C3 project and also many other projects I've worked on, particularly with Dr. Lee Rosendahl and many others that are part of the C3 team. And they really did emphasize with the C3 project that there'd be CHW leadership. So there were CHW supported on the core team to work as leadership. The outreach core had 2 CHWs and an ally who led that. And they were the kind of the arm, the branch that reached out to folks and communicated with folks. We engaged CHW experts as chairs and advisors. We consulted with CHW networks as key stakeholders in the process. And I just want to point that out, that the key informers of the C3 project report and the list of core competencies were CHWs and CHW networks. And so CHW self-determination, also known as Kuji Jakalia, has been paramount, has been our guiding principle, and it follows an APHA CHW section resolution, which became an officially adopted APHA policy about having a majority of CHWs be part of any groups that are coming together to talk about CHW policies, training, as well as projects. Next slide, please. Part of the work of the C3 project during the 2014 and 2016 phase included reviewing and exploring some seminal documents, papers, reports, including the National Health Advisor study, and doing a CHW-led feedback and crosswalk process, where we reached out to CHWs, to all known CHW networks, associations, and alliances, and to many longtime CHW allies and champions. This review process and crosswalk led to the development of the nationally recognized C3 list of core roles and skills. We'll be talking a little bit more about that today, and I'm sure many of you all are familiar with it. In the next slide, we just want to illustrate that at the time we started, there were about 45 CHW networks and associations around the country, as well as some alliances. And we reached out to all of them. And we not only reached out once, not twice, not 3 times, but multiple times to really engage all of the known CHW networks. That work yielded approximately 26 networks, associations, excuse me, who had at least 4 or 5 members of their team review and provide feedback. We used I'll say wonderful process to integrate that feedback. So imagine you had feedback from all these places, some of that feedback at times conflicting with other feedback. So we used a systematic way and a process to truly integrate, to value all that was provided to us and to truly integrate that to finalize the list and the report. So I just want to acknowledge that that process was major and it was critical to what we did then, and it's critical to what we're doing now. And I'd like to turn the microphone over to Paige. Next slide, please.
Ooh, it's time for a new mouse. I couldn't get to my mute button. So thank you, Darrell, so much for sharing about kind of how we got to this list. And now it's my job to talk to you about the list itself, right? So this whole beautiful process of building national consensus so that we can better describe the work that CHWs do and the preparation and training that they need in order to do their job well. We ended up with this list that we first published in 2016. So the idea behind talking about the roles and scope of practice is so that we're able to answer the question, what is it that CHWs do? If folks are not familiar with the job of CHWs, which many folks at this point still are not, this is how you can describe what they do. And we know that not every CHW is doing every single one of these roles every single day, but the idea of talking about the 10 core roles is that this is what is within this broad and beautiful scope of practice that CHWs can do. And that at any point during their career and their job, that they can touch on any of these, and that they should be allowed and encouraged and trained to do all 10 of these core roles. So let's talk about them. What are these core roles? So first off, we have cultural mediation. And what this means is not only helping folks from a different culture, hopefully the culture that the CHW shares with them, to understand what is even going on in the social care, the social services and healthcare systems, right? So what is it that their doctor is saying? And we're not talking just about, interpreting into their language, but interpreting it into their cultural customs and their norms and helping the system to make sense to them. But we're also talking about doing that cultural mediation back to the systems. So helping systems to understand what are the needs of the community, what are the cultural tidbits and practices that they're not understanding and not adequately serving. So you hear lots of folks talking about CHWs as bridges between systems and communities, and that's what we're talking about when we say that CHWs do cultural mediation. Additionally, CHWs, of course, provide a lot of culturally appropriate health education. So this means helping folks to know what it means to have diabetes. What does chronic disease self-management look like? What is, healthcare information, social service information that they can share with folks in a way that they understand? So meeting people where they are, using accessible language, and making sure that folks understand this health information that they're sharing. Care coordination, case management, system navigation. Again, this is really helping folks to understand who is it they need to call, what is the role of their primary care provider versus their specialist, versus their oncologist, versus, all of the different folks in their care team. Who do they need to call to get what services? All of that sort of stuff that even for those of us who have been in this field for a very long time still don't always understand. So helping folks really know how to get around, how to get what they need from a system. Providing coaching and social support. So this is the idea of really being that friend, that, warm shoulder for folks when they are going through a really stressful, scary situation, but also helping folks who are really trying to make big changes in their life to manage a chronic illness. So this is using skills like motivational interviewing and goal setting to really walk with somebody in this journey of behavior change. Advocating for individuals and communities. So this means not only advocating for patients and clients, perhaps by, working with their healthcare team or calling their insurance company or whatever that looks like to get for that client what they need in order to be successful, but also advocating for communities. So this might mean talking to policymakers. It might mean mobilizing the community to make changes in the community, to get, to get more access to healthy foods, or, access to parks where folks can recreate and exercise. And so really looking at advocacy on a community level, on a client level, and then also on a profession level. So looking at how to advocate for the CHW profession as well. We have building individual and community capacity. So, these first 5 skills are really about how to do these important things for your clients and your patients. But then number 6 gets into this idea of how do you help your clients and patients to be able to do those things for themselves? How can you make sure that they build that capacity within themselves so that when invariably your time with them is over, that they feel capable to go and advocate for themselves and navigate the system themselves, and that they know where to go to find social support and coaching outside of your services as a CHW. And also on the community level, right? How do we work at mobilizing communities, looking at population health, and CHWs have a really critical role in helping to build that capacity in the community. Direct services. So when we're talking about direct services, we're looking at things that are within the scope of CHWs, right? So things like doing blood pressure monitoring or glucose testing, right? And many folks who are community health representatives in our Native communities in the US might do even a little bit more. Things like diabetic foot exams or doing wound dressings, right? So these are things that CHWs can be trained to provide without having to have additional medical licensing. So these types of direct services that act as an extender of the healthcare system. Implementing individual and community assessments. So when we talk about that, what we're talking about is when you sit down with a client, how do you assess what their strengths are? What are they already really good at doing? Where do they have lots of resources that already exist that you can tap into? And then what are the gaps that you really need to find solutions for? So when we talk about assessments in that way, we're really talking about how do you make a plan to work with this client? And that extends to the community as well. So looking at what are the strengths in a community? What are programs that can address the gaps that are in a community? Outreach, of course, is super critical. It's also a critical role in CCR, we know. So pretty self-explanatory, but the idea is that folks are extending the systems that they're working with out into the community. They're meeting people where they are. They are physically being in community with folks who might not have good access or understand how to tap into the resources that exist in the community. So literally bringing that knowledge out to them in community. And then finally, participating in evaluation and research is a skill that CHWs are, or a role that CHWs are so great at when they get tapped for doing this kind of work. We know CHWs have trust they've built trust with the community. And so the information they can get when they participate in a research project is going to be much better than the information that, a 20-year-old college student who's never been in community might get, right? So we know that they can collect amazing and deep and rich data, but we also know that when CHWs participate in research and evaluation, they can speak up to make sure that that research project is really representing the needs of the community and will ultimately serve the community in a more deep and authentic way. Okay, next slide. So Darrell said, when we talk about competencies, we're talking about qualities and we're talking about skills. So what are the qualities and skills that CHWs need to be competent at the roles that they are doing as a CHW? So qualities are really, what are those innate characteristics that CHWs have that make them good at this work? We, as the C3 project, we did not develop our own list, but instead we we endorsed the research by Noel Wiggins and Sergio Matos about what are the qualities that are really important to CHWs. We are hoping to review these again and create an updated list in future iterations of the project. But we really intentionally affirmed that the most important quality is that CHWs are connected to the community. They have this shared life experience that makes them better able to understand the barriers that their clients and their community are facing, and that they know how to address them because they have been there, and they're able to build trust because they are from that community. So we love this little word cloud heart. It's important to note that qualities are something that cannot be trained, right? So when we're recruiting folks into this field, when we're recruiting people for trainings, or we're finding folks to employ as CHWs, we want to be screening and really looking for and recruiting for these qualities, finding folks who already have that connection, who already are leaders, who are patient, who are dependable, who are compassionate and empathetic. So that's where these qualities come in when we're looking at programs. Okay, next slide. Finally, we have the skills. So when we're talking about skills, most often we're talking about it in the context of training. How do you train community health workers to do their job? And this might be through a formal core competency training, or it might be through on-the-job training. But this is what folks need to be able to do in order to perform the roles that we already discussed. So many of these match up to some of the roles. Some of them are a little bit more freestanding and floating and are used in every role, but these are the things that we really want all CHWs to be able to do by the time they're done with their training. So you really want folks to have communication skills, to be able to communicate with a wide variety of folks, right? Both their clients and their colleagues and medical professionals and policy leaders, right? So what are the communication skills that apply across a wide variety of settings and people? Obviously, interpersonal and relationship building, they have to be able to get along with folks, even folks who are really difficult and grumpy and ornery, and folks who are standing between them and what they need to get. So interpersonal skills is really critical. Service coordination and navigation, of course, is what we were discussing earlier. So having all of those sub skills of, being really organized, knowing how to, access all of these different pieces of the health and social service system. Capacity building is what we discussed earlier as well, right? So how do you build up the skills, or the skills and the confidence that the clients that you're working with and the community you're working with have to take on the challenges that they're having. Advocacy, how do you talk to, folks in power? How do you talk to policymakers? How do you talk to folks in an insurance company to get what you need from them? Education and facilitation, how do you provide that culturally appropriate health education? How do you facilitate groups? How do you facilitate community sessions, right? Individual and community assessment. How do you do these initial assessments with your clients to know what it is that they need help with? Outreach, of course, how do you go out and be social and get folks' attention when they are really focused on other things? How do you do your little elevator pitches for the resources that you're sharing? How do you really just meet folks where they are? How do you choose where to go in the community? All of those sorts of things that tie into outreach. Professional skills and conduct. So when we're looking at this, we're looking at what are the ethical considerations of being a CHW in community? What are the professional skills you need to have in order to navigate the field and be able to communicate well and get your point across to folks in a wide variety of settings and professions? And then evaluation and research, of course, what are the main skills that you need in order to be really good at doing focus groups or one-on-one interviews or delivering surveys or understanding how you build a research project and plan. And then finally, knowledge base. Knowledge base is a little bit of a catch-all, but when we talk about knowledge base, we're talking about what are the very specific things you need to know to do the role that you're in. If you are working, for example, in CCR, specifically around emergency preparedness, COVID-19, what do you need to know about COVID-19? What do you need to know about emergency responses in order to do your work? It might be knowing about diabetes self-management, if that's what your role is on, or asthma, right? So this is where you really get the specialized training and skills that you need for the specific job role that you are in. Next slide. Okay, and back to Darrell.
Thanks so much, Paige. So you've heard a lot about how C3 came to be. You've heard a lot about the list of core roles, core skills, and qualities. And there were some additional questions that were being asked about CHWs, like, are these core roles and skills needed in all settings? Are they the same in all settings? And that really kind of led to kind of a new exploration and examination of CHW core roles and skills in different settings. And so you'll see on your screen two wonderful, I don't know, pictures. I can't find the words today for some reason, but they really are a way to illustrate a few things that we looked at. And the one on your right, we actually developed into a dance that some of you guys who might have been at Unity a few years ago were involved in that dance. But anyway, on the left, you'll look at the continuum of CHW settings that we explored. And that goes from community-based and community-focused CHWs all the way through to CHWs who were kind of community-based and clinical-based, and then all the way across to CHWs who were solely based in clinical settings and focused on clinical work and clinical settings. And what we found through our research is that no matter which setting the CHWs were in, although they employed their skills, employed their knowledge in some ways differently, they had to use it differently because of the different systems and the ways those systems operated. But they all had common roles and skills across that they utilized no matter what setting they were in. And again, they might have applied them differently. They might have had different requirements based upon the setting they were in, but they all used those same core skills as the essence of their work and the same core roles and the essence of their work. They also needed those same qualities. So I think it really did illustrate and demonstrate. Some people would say, well, you see one CHW, you see one CHW at a community setting. They're different than when they're in clinical setting. And we really wanted to explore that. I think we may re-explore it, but based upon all the conversations, the focus groups, the feedback, we saw that our work was done well because those roles and skills were common across, no matter what setting. They were very useful and valuable. They were also very useful and valuable based upon the issues that CHWs faced, whether they be focusing on social determinants of health, whether they be focused on clinical issues, navigating systems, navigating communities, et cetera. Those skills were really critical to the success of those CHWs. So while we will be re-examining those roles and skills, we absolutely felt very positive about this finding that was published back in 2018 as well. I think that's all I'll say about this. And Paige, I want to maybe turn, next slide, please, next slide. So I'm going to pause for a moment and turn the microphone over to Paige.
Thanks, Darrell. So we've been spending the last, 45 minutes talking about this wonderful list of core roles and skills developed by the C3 project that's nationally, like we built national consensus, right? It's validated and by CHWs, but you might be sitting there thinking, my state has a different list, right? So, if your state has CHW certification, it's very possible, even likely, that the list of competencies that have been adopted by your state certification program look different, either a little different or a lot of different. And so we want to address that, right? So this list, the CHW Core Consensus Project list of roles and skills, and really most of the time when we're talking about lists and state, we're talking about skills, is really important for building national unity, national identity, and giving us a shared language to discuss the CHW workforce, right? We want to be able, Jarrell and I are from two different states, but we want to be able to go to Capitol Hill and talk to national lawmakers or talk to CMS or CDC or whoever that might be, and have a shared language about the work that CHWs do and the kind of support that they need. And so if we're coming to the national scene and using only our own state lists, that gets real confusing real fast, right? So the C3 project roles and skills are critical for building this national unity around the workforce and having this shared language. You will need to use your own state's list when you are talking about certification, when you are supporting training programs that want to pursue certification, right? Oftentimes states bring up opportunities to reevaluate and look at their list of skills and roles if they have them. And we encourage folks to open up a discussion and advocate for aligning the roles and skills to the national workforce and whether that makes sense for your state. So that is a place to have to participate in some advocacy for the workforce in better aligning what's going on in your state to what's going on nationally. We want to note here too that we are really looking at, as Jarrell mentioned, hoping to review the roles and skills. Many other disciplines review the roles and skills every 5 to 10 years, and we are now at about 8 years. So it's about time for us to do it again, and we're really trying to get that moving and reevaluate. We're also very interested to see if the pandemic and all of the increased attention to the CHW workforce in the last few years have made a difference in the type of work that CHWs are doing and the type of skills that they need to be trained on. So we're really hoping to do that soon. And here, I really want to take a minute to note as well, Monique just dropped the link in the chat. We have developed a tool that y'all are the first ones who get to try this out, this newly developed tool to work on aligning or at least crosswalking the skills that your state has adopted to the C3 project so that you can better understand, okay, if I'm looking at my state skills or competencies that have been adopted, is there anything missing that we need to think more about adding into our curriculum, even though it's not an official competency that we have to check off for state certification? Or is there feedback we want to provide to the C3 project that we have a competency that's critically important in our state that is not being represented on the C3 project list? So we are really excited to offer this to y'all. We would love any feedback you have on this tool, but you can download that from the link in the chat, and we encourage you to look over that if you are a state with an official list of competencies before our next training in a couple of weeks. All right, next slide. Okay, so we're going to get ready for breakout rooms, but I want to pause and see, Darrell, do you have anything you want to add before we go into the rooms? Anything we've missed?
No, thank you. It's just, you've heard from us a few different ways, but we will be looking for your input, for your feedback, for your connection as we move forward. So please look out for more from C3, and Paige just referenced the ongoing trainings that will be available to CCR recipients. And so we really want to get people engaged in this. I mean, this is another moment in the movement where it's critical to get as many CHW voices as possible. So thank you so much, Paige and Vision, for providing this platform. Thank you.
Okay, so with that, I will set up our breakout room plan. So we have 7 rooms, and you have already been assigned to a room. We are going to be spending the next half an hour looking at what even does this mean for the CCR project? What is the relevance of the core roles and skills to the work that you're doing in CCR? So we've organized the rooms using the CCR logic model. So you're either going to be talking about training, deploying, or engaging community health workers and how to utilize the C3 findings in all of those different domains. We'll have one room for Spanish speakers in room 7, and y'all will be talking about training. So in a few moments, you'll be zipped away into those rooms. So we have created some worksheets with scenarios and discussion questions. So Monique just put the link to that in the chat. There's also one in Spanish is the second link. So please pull that up. You'll need that in the breakout rooms. And then once you get into the breakout rooms, we'll be putting all of our thoughts into a Jamboard. So your facilitator will be sharing the link to your Jamboard once you get into those rooms. And we'll have 30 minutes in each room because we're a little ahead of schedule. So we got to add 5 minutes to our rooms. And I think that's it. I think that's the setup. So Caitlin, are we ready to go into our rooms? Okay, well, let's go. We'll see y'all in your rooms.
I want to thank everybody who was part of my room and all of the rooms. What you see on your screen now, we're not at the end of the session, but we wanted to share this now because this is an assessment that's going to take a few minutes to fill out. And this is an assessment from the C3 team. We're asking for your feedback. I think we can probably put the link in the chat as well. If someone has that handy, I can. We would ask you to, if you can take a moment or two now, we can pause to start filling this out. This is in addition to the regular evaluation you will get from Envision. This will help inform the C3 project as we do our deliberations this year into next year. This will help as the C3 project works with the CCR programs and the upcoming trainings. So we really value your input. And just so you know, the C3 project, at every moment we can, we'll try to capture feedback and input from community health workers. And so that's one of the reasons why we're urging people to fill out this form. And this is the C3 feedback form. It has a few additional questions you'll see on it. And in a moment, we'll hear from the Envision team. Next slide, please. I guess we can probably give another minute, Paige. I don't know if you, but this will be you. Thank you.
Yeah, we'll give you a couple of seconds to get that open. Then I will talk through this slide. Okay, Caitlin, you can go to the next slide. Feel free to keep filling that out while we talk through these last couple slides. So we just wanted to quickly review the tools and documents that we shared in this training that you have available to you now to use and to share with colleagues. So the self-reflection worksheet that we emailed out earlier this week and also put in the chat earlier. For you to really think through what are the roles and skills that we're using in my programs or in my community, and what are the ones that are missing? What do we need to spend more time on? We have the mapping tool that we talked about of how to look at your state's competencies versus the national competencies we presented today. We have the worksheets that we looked through during our breakout rooms. And then finally, within the next week, we'll be sharing, kind of a post-session reading list, things to follow up on, and an action planning worksheet that will complement that self-reflection worksheet from the pre-session that helps you think about how to translate some of the things we talked about today into action or goals you can set for your own program. Next slide, Caitlin. Okay, and then Monique just put the link in the chat to the C3 Project resources page on our website. We have all of these beautiful things on our website that you can pull down. So we have a great info sheet that shares a little bit about, how we built the list of core roles and skills, and also has them listed out on the back page. We have the assessment toolkit that's really great if you're looking at how to do assessment of CHW performance, and supervisor assessments and job descriptions and interview guides. So that's a really great tool. And then the final reports, we have the poster that I think many of the CCR programs already got copies of, which is great. So those are all available on our website, along with the video we showed earlier in English and Spanish. And we're constantly updating that page, so check back, because every time we develop a new resource, we drop it in there. All right, next slide. Okay, and our last slide, if you need to reach us, please email the info@c3project.org. I personally monitor that email inbox. So if you reach out, know that it's a real person who's going to answer you, and it is me. And if you need to reach anybody on our team or have any questions, I can field that and get that to anybody on the C3 Project team. And please always check in on our website, and we really appreciate you being here. And with that, I think I'm handing it back over to Mongshi.
Next slide, please. Yeah, thank you to Paige and Darrell for providing such great information on C3, and we're totally looking forward to the upcoming training we have available. So Caitlin, can I go to the next slide, please? Like I mentioned in our previous webinar, today's webinar is actually the kickoff to our C3 training series. So I'd like to introduce you all to our very first specialized training offer from Envision. So this is basically the continuation to today's webinar, and it will focus on applying C3 project resources and tools to assist CHW core competencies and roles. And then the link to the training will be dropped in the chat for participants to register. Next slide, please. So we do have upcoming webinars for the month of July as also. So next up, we do our evaluation team's webinar will be on July 12th, and it's focused on best practices in data management and security. So the registration link for that will also be put in the chat. And then our Envision team, we will also be introducing the new features we have added onto our website. And we would like you to learn, so if you would like to learn more, please join us on the July 27th at the same exact time to learn more about Envision Equity's new platform and resource page. Then again, registration links are being dropped in the chat below. So now I would like to open up our polls. So Caitlin, can you open our polls? Thank you everyone for taking your time to answer the poll questions for us. That's really important for us. And just thank you all to the participants for attending our webinar today. We cannot wait to see you all again next month. And thank you to our facilitators as well. So please everyone have a nice day and enjoy the weekend. So thank you all for coming.